Hello, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about the difference between pulsing antibiotics and continuous antibiotics. There's a huge amount of discrepancy about whether or not you should pulse or not. In my training, Dr. Jones, who is a world-leading pediatric Lyme specialist, said, "You never pulse." But Dr. Horowitz, who's also a world-leading Lyme disease specialist, has been pulsing for 30 years. So I think it's an individual decision that you can make. And what I have found is that pulsing can be really, really helpful for some people. And I'll explain to you why. Especially people that have multiple infections and are poor detoxifiers. Okay? Poor detoxifiers means that they don't get rid of toxins easily or quickly. And that can really, really wreak havoc with you. So, continuous antibiotics is when you dose whatever antibiotic. It's usually twice a day, but it can be once a day or it can be 3 times a day. And when you do antibiotics continually, you get constant killing, and the debris of the dying spirochetes and Bartonella and Babesia goes into the bloodstream and has to get filtered. It gets filtered by the kidneys, and then goes through the liver, and the liver can get overtaxed easily. And those toxins build up, and people get sick as a dog. And that's what we call a severe Herxheimer reaction. And we've already talked about what to do for a severe Herxheimer reaction. So generally, I like to do continuous antibiotics in people that have fewer infections and have not been chronically ill for decades. Okay, so if you're chronically ill for decades, you're going to have detox problems. It's just the nature of the beast. And that's when pulsing is so useful. For example, somebody comes to me, they were infected as a baby at age 5, and now they're 40. Well, that's 35 years of infection brewing. It is very, very tricky to treat that kind of a patient, and you have to start low and go slow. So what I do is generally start pulsing like Monday, Thursday, or Tuesday, Friday, see how they do. If it's still too much, then dose them once a day, 2 days a week. And then as they begin to get used to it, then go to twice a day, 2 days a week. Then go to 3 days a week. Then go to 4 days a week. And there are some drugs, for example, Coartem, which treats Babesia, that you have to pulse because it's so hard on the liver. That's also true of artemisinin, which is an herb. That's also hard on the liver. And I like to pulse itraconazole too, because itraconazole can be hard on the liver. So I just dose it every other day, and it's fine. We never have any problems with liver enzymes or anything from itraconazole. So pulsing is a nice way to keep the Herxheimer reaction to a dull roar and to allow people to adapt physiologically to the killing of all the microorganisms that are contained within them. So I use a combination of pulsing and continuous depending on a number of different factors, but mostly how many infections you have and how long you've been sick. The longer you've been sick, you cannot continually dose. You will make the patient so sick. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.